Are you sure? God damn it. I hate when this happens. Fine. I'll make another video. Apparently, in my rush to try and explain how everybody was getting screwed with buying gear, I kind of forgot to tell you what you're going to get for your 91 bucks. I thought it was clear, but I guess in today's video age, you got to go the next step further. So what we need to do is just take a quick look and then I'll explain it. Okay, so basically the kit's going to be broken into 4 very logical modules. We're going to break it into the actual trauma module, and this is going to be full of the big stuff. Then there's going to be 2 bleed kits. One bleed kit will have more stuff in it than the other because this is your starting point to rendering aid. And the other bleed kit is kind of like, hey, I don't have enough stuff. Here's more stuff. And then there's what we're calling the Protect Me kit. The Protect Me kit is exactly that. Stuff that's going to protect you and the other stuff that is going to help you finish treating the patient in preparation for help to come. So first things first, the trauma kit. The trauma kit is going to have the Nasopharyngeal Airway with lubricant. Obviously, you're going to need some training in order to use this, but it's really not that difficult. The next thing is going to be the Halo Vent chest seal. We picked this because it's actually larger than most other chest seals, and it is clearly marked as front and back for entry and exit wounds. Really simple to use, and it outperforms all the other chest seals. The other thing is going to be the burn dressing. The burn dressing that we chose is actually a burn blanket, and it's half the cost. If you do use it, you can get it off Amazon for like $6, and what it basically does is allow you to cover a wound, pour water on top of it, wrap that up, and then you'll be able to transport it much easier. Statistically, this is the safest way to do it, and you can actually cover more body area instead of trying to use that little 4x4 patch to a burn victim. The other thing we threw in there was the pocket-sized duct tape. The reason we threw that in there is because it has so many uses on the medical side. You can use it to wrap a splint. Oh, by the way, yeah, there's a splint in here too. We're going to throw that emergency Mylar thermal blanket in there. It does help because the end portion is always treat for shock. And obviously we talked about the SAM splint. The next thing in there is going to be the bleed kit number 1. Bleed kit number 1 is going to have that cat tourniquet in there. We've seen this 1,000 times. We're going to make sure that it's a quality one, no Chinese junk. We're also going to use rolled gauze. Rolled gauze is the number 1 way to treat open wounds. Stuff it in the wound, you can really pack it in there, and then you wrap it up. You can cover it with a 4x4 piece of gauze, and then you hit it with the ACE Velcro wrap. This is the best way to treat. This is how the paramedics do it. Obviously, we'll have gauze 4x4 strips in there, more than enough per kit. And we're even going to throw a little surgical tape in there, and obviously some trauma shears, because when we get to the patient, we either need to remove clothes or we need to cut something so that we can find the wounds. Bleed kit number 2 is just a smaller version of bleed kit number 1. Why? Because bleed kit number 2 is more designed to help you with multiple wounds, or if you run out of supplies from bleed kit number 1, bleed kit number 2 supports that. It's going to have another thing of rolled gauze. It's going to have more 4x4 gauze. It's going to have another ACE wrap in case you have multiple wounds that require to be wrapped. And then there's the last kit, which is the Protect Me gear. Protect Me gear, it's going to be a couple sets of Nitrile gloves. They're going to be to your size. We're going to get some 3M safety glasses in there for you. They're actually pretty cheap. And most people don't know that when somebody's been shot, they like to kick around, or when they've been badly wounded, they like to kick around because they're in shock. And if they're bleeding and you get it in your eyes, yeah, you're going to have a bad day. Obviously, the permanent marker for writing on the laminated triage kit so that when the real paramedics show up, they can literally go, "Durr, that's what got fixed. This is what we need to focus on." Now, it should go without saying that this is a total prototype, but all those things are going to be inside of it. There's going to be labels on the package, and you're going to see something very similar to this. Now, I do hope that all helped you out. If you have any questions, put them in the comments. And yeah, $91. Hope you have a great day.